Hello, NEET aspirants. Welcome to PhysicsWallah English channel. And today we are going to start with a topic that is reproductive health. Now, this chapter is not very large or big. It is a small chapter, but many questions are coming each and every year from this chapter. So be focused till the end and utilize each and every minute of this. So let's see which topics we are going to cover today. Each and every topic of NCERT we are going to cover. The first topic of NCERT will be the reproductive health and what problems are there and what strategies have been followed. Next topic will be on population stabilization. Why is it needed to stabilize a population and what are the birth control methods used for that? Next will be the MTPs, the medical termination of pregnancies. They are legally recognized and they are important to maintain a stabilized population. And even it is important for the health of the mother and child sometimes, especially the mother. Next, we'll be talking about the sexually transmitted infections or the STDs, that is sexually transmitted diseases, how they are spread, which are viral, which are bacterial. We'll be discussing about this also. And lastly, we'll be discussing about the topic that is infertility, that is assisted reproductive technologies which are used these days to help the couple to have baby. So let's start with our topic, that is what is reproductive health? What do you understand by this? Is it only having the normal reproductive organs which are functioning normally? No, it is much beyond that. Your mindset matters a lot. How you are behaving in society, how you are behaving emotionally, that is also very important. So let's see the definition given by WHO. So WHO says reproductive health means a total well-being in all aspects of reproduction. That is the physical, emotional, social and behavioral aspects. That means one should be very sound mentally and physically. For example, someone who is not accepting your proposal, it doesn't mean that you should force someone. You have seen some acid attacks which are not anyway justified in a healthy society. Rape cases can't be justified anyway. So these are really a big problem for a growing population which has to be tackled. So a society also needs to understand what are the norms should be followed and some strict and punishable rules should be there. Okay, so let's discuss more about this and let's talk about what the problems and strategies are there regarding reproductive health. So let's see about the population explosion. Now it is a very big problem because the overgrowing population will exploit you, will not allow you to use the resources properly. And this is the big problem. You see how it is there, why it has increased, why the population has increased. Now medical facilities has increased very nicely. They have developed much more techniques have developed. So because of which there has been a decline in the death rate. So decline in death rate has resulted in population explosion. Next is the decline in maternal mortality rate. Better medical facilities have resulted in having much more healthier mothers as compared to the previous generations. So that is decline in maternal mortality rate. Even infant mortality rate also has declined due to better medical facilities being provided. Now what happens? Now the growth, the number of addition of new birth is increased, mortality has decreased. So what will happen? The population size is going to increase. What has happened is immigration has increased in India and emigration has reduced. So that has resulted in a population size which is ever growing now. It is fast growing population because of these reasons. So let us find out what strategies have been followed. So India was among the first countries in the world which had adopted family planning programs. In 1951, these programs were initiated. But now the many other programs have been combined and a new program has been launched that is called as RCH, that is Reproductive and Child Health Care. Please write down Reproductive and Child Health Care. So this is the program in which much more areas have been taken into consideration. So let's see. Reproductive and Child Health Care is the program here. This was initiated in 1977 and it has much more programs apart from only the family planning program. It has much more wider approach also. Now let's see what was the role, what is the goal of family planning programs. Now, suppose a couple has around 2 kids now and they want to stop addition of more members in the family. So they don't want to add more members. So they have to go for what? They don't want unwanted births. For that, some contraceptives have to be given. And they have to be properly advised to them. So that is the role or the goal of the family planning programs. Now, it is very important to regulate the intervals between the pregnancies. It is very important for the health of the mother and for the health of the child, so that proper spacing should be there between those 2 pregnancies. It is very important. Otherwise, mental and physical health also can be affected. So this is to create awareness also. Family planning programs have been creating awareness also. So let's see how they are creating the awareness. Let's see here. Now, proper information has to come to you. It is not that some myths or misconceptions should be followed. Proper information has to come. And especially in the adolescent age, you have much more, changes in the body. The hormonal changes are happening. And so proper advice should be given to the child, that adolescent child. So let's see how. Safe and hygienic sexual practices have to be followed. Okay. Sexually transmitted disease which are their information should be provided to the people, and especially to the adolescent age group. These are very important so that they should not come in the wrong hands or they should not come with the false information. Let's see more about awareness, how it is created. Now, in the awareness section, especially the fertile couples, those who are in the marriageable age group, they need to understand. They need to know about the information on how they are going to space the pregnancies. What is the contraceptive options available? So those awareness has to be created and those information has to be provided to the couples which are going for they are in the marriageable group. Now, moreover, after that, how the care of pregnant mothers will be done. What is the postnatal care of the mother and child, how it has to be done, that has to be created. Awareness has to be created. Hospitals and non-government agencies have to work along. They have to spread this information properly. Moreover, importance of breastfeeding has been very well, the information has been distributed. It has been distributed very well. So these all information will be important for a healthy living society. A society which is reproductively conscious, a socially conscious, which is bringing up, some healthy families of desired size. For them, the information is very much required. Otherwise, the family size should not increase. That also is very important. If they have more babies, they'll not be able to take care of them. More children means they may not be able to provide them proper education and provide them proper, resources which are required. So that can lead to much more problems. And even if it is a case of poverty, it can be much more dangerous then. So let's see what kind of more awareness programs are going on. Now, in any way, if any case of sexual harassment or violence or sexual crimes are there, they have to be reported. A society must make their citizens more aware of their rights and how to express that, how to report those cases. That also is very important. So this is very important in terms of awareness. So awareness of problems which are due to uncontrolled population, like social evils like sex abuse and sex related crimes which have increased, they have to be reported properly to the authorities. And a healthy society has to make sure that the proper proper decisions are done on that, and proper rules are made for that, and it is important that punishment also should be given to the offenders. That should be a lesson to others. So that is an important awareness by the society, and the family planning programs and the reproductive and child health care programs are also initiating these. Now very important technique is there called as amniocentesis. These all strategies have been employed to make the couple know about any problem which they are going to face. If they are going to have a baby and the baby has some genetic disorders, that can be a problem to them. So before, if they come to know about those genetic problems, they can be well prepared, or if they don't want a baby, that they can decide on that. So how it has been made aware? It was due to the technique called amniocentesis. In amniocentesis, a small amount of amniotic fluid is taken. As you can see here, little bit amount of amniotic fluid is taken, but it's not that easy also. You can't just insert a syringe and take out some amniotic fluid. You have to be guided under the process of ultrasonography. Okay, you have to check, no, in no case this needle should insert any part of the fetus. That is very, very important. So you have to be guided with the proper ultrasonography, and little bit of amniotic fluid is taken. After that, it is cultured. Those cells are cultured, and if any chromosomal abnormality is there, that is detected. For example, what kind of genetic disorders you can detect? Like Down syndrome, hemophilia, sickle cell anemia, all these kind of genetic disorders you can know from that. But as you know, there are always some disadvantages also if people are not using it properly. For example, the knife was invented to cut fruits and vegetables. Now someone is using that knife to insert in someone's abdomen. Is it justified? It is no way justified. So in the same way, there's such a nice technique was developed to know the chromosomal abnormalities before birth. But what people started doing in some parts of India also, what was being done is they were able to know the sex of the child, because the chromosome number you can check, the 23rd chromosome number, pair of 23rd chromosome number you can check, and you can know about the male or female. And when they used to know about those female child, they used to go for female feticide, which was really dangerous for any society. It is very dangerous, because if you don't have a balance in the sex ratio, that can lead to much more major problems in future. So this technique has been banned now. It will be advised only in some cases when it is recommended by the medical practitioner. Otherwise, it's not recommended because of the fear of the female feticide going on in some parts of India. Now, which is a better technique now? Is it chorionic villi sampling or is it amniocentesis? Yes, chorionic villi sampling, which will be more recommended as compared to amniocentesis, because in amniocentesis you have to insert the syringe inside the amniotic fluid, and sometimes because of disturbance, this amniotic fluid can get disturbed and there can be a miscarriage also. So better technique is there, that is chorionic villi sampling. Through the vagina they can insert those catheter and take some part of the chorionic villi, and they can analyze those chromosomes. That is much better. But in any case, this can be extended till for 15 to 20 weeks. You can usually use it, but this will be used till 14 or 15 weeks. So that is a little bit disadvantage there. Okay, hope you understood between the chorionic villi sampling and the amniocentesis. Okay, as the word says, chorionic villi sampling. That means you're going to use the chorionic villi samples. So this is the chorionic villi. Okay, this is the chorionic villi. So you're going to use a sample from this part. Okay, whereas in the amniocentesis, you're going to use some part of the, you're going to take out some part of the amnion fluid. Is it okay? Yes. Now we'll talk about some new researches which has helped, make some better strategies. So for any country, good research is very helpful. For example, contraceptive pills were being used in such large numbers. But as you know, the contraceptive pills have steroids, and steroids are always harmful. Whether the company promotes that they have no side effects, somewhere the side effects are definitely there if you are using steroids. So for that, CDRI, there's an organization in Lucknow called Central Drug Research Institute. It is a CSIR institute, that is a government organization which has this organization many parts of India. It runs bigger institutes, big institutes here. So this was the one, that is CDRI. Scientists of CDRI developed one special drug which was non-steroidal. This was world's first non-steroidal pill, and this functioning was a bit different. So that's a really big thing for India. And so those researchers helped produce this drug called Saheli, which is anti-progestrogenic. So in that way, it is very important, and it is not helping. This contains a component called centchroman. So it is anti-estrogenic, because it is going to block those receptors of estrogen. Okay, so we'll talk about details also, don't worry. We'll be talking about the details about Saheli also. It contains a component called centchroman. You can see here it's written also. So this was the first non-steroidal pill or the contraceptive developed by CDRI. Now, what are the population stabilization process? How we are going to stabilize this population? So population, the world population in around, it was 2 billion in the year, that is 2000. In 1900 it was 2 billion, but in 2000 it became around 7.26 billion in the 2000 and 7.2 billion in 2011, and now it is around 9.3 or 9.5 billion almost. And again, it's going to add around 2 billion more people by around 2050. So this can lead to havoc. Yes, there can be some, we can't predict anyway, but yes, there can be some pandemics or epidemics that may cause a decrease in population. But still, the progress at which the human population is proceeding, that prediction says that around 2 billion people will be added more on Earth, and 2 billion more humans will be added in the population, world population. That can be really dangerous. Now, India also, you see, around independence, it was very less population, around 350 million only. But it crossed around 1 billion mark by 2000. And now it has around 1.2 billion in May 2011. And now it's exceeding 1.6 billion now at present. And according to the 2011 census report, it says that growth was less than 2%. That is 20 individuals per thousand per year. So this was a rate at which, if the population would have increased, that can lead to much more major problems in future. And you can see also around 2.55 billion people are going to be added. They have been added in last 30 years. So 2.5 billion people, if they are added, they need to have some resources, they need to have food. So pressure is going to come on the food resources also. So this is a major problem with the population. Now for that, what is the strategy? Indian government has formed a strategy to raise the age bar of the females and males both to 21 years. So now there's a union cabinet who has given a proposal of marriage age of women also from 18 to 21. So this can be a little bit a step towards population stabilization. Now, for that, what are the methods how we can stabilize this population? So we can use some contraceptive pills. So the awareness for contraceptive pills can be given. So birth control methods are very important to control the population and stabilize it. Now, what is an ideal contraceptive? So ideal contraceptive should be user friendly and it should be easily available. If you are going for purchasing it, you should be easily available to you. It should be cost effective and it should be reversible with no or least side effects. So majorly you won't find any of the ideal contraceptive usually. There's nothing called ideal contraceptive which is present these days. Any contraceptive which is there will have a little bit of side effects also. So anyway, which is just closer to the ideal contraceptive that can be, recommended. Let's continue further. Moreover, this ideal contraceptive should in no way interfere with the sexual drive or desire or the sexual act of the user. This is very, very important. Now let's continue further and see what kind of contraceptive methods are there. So contraceptive methods are preventive methods, especially they help women avoid unwanted pregnancies resulting from coitus. That doesn't mean that men don't use it. Most of the contraceptive, if you see, they are meant for women, except for the condoms and all for the males. Okay, so that's why we usually recommend more, make females more aware about these contraceptives. So let's talk about, there are two types of methods. One is the spacing method, other is terminal methods. In terminal methods, there is no reversibility, that is tubectomy and vasectomy. But in spacing methods, there are different types of methods like barrier methods and all. So we'll discuss one by one. In this, you can space. If you don't want, the baby for around maybe 1 or 2 years, you can space it. So let's see what types of methods we have. So spacing methods are barrier methods. They can be physical, chemical, or combined. Next is the intrauterine devices, that is IUDs. These are the IUDs, intrauterine contraceptive devices. Next are the hormonal methods. And terminal methods are the male sterilization and the female sterilization. Male sterilization is your vasectomy and female sterilization is your tubectomy. So one by one we'll discuss all these contraceptive methods. So let's talk about the barrier methods first. In barrier methods, you see, the condoms are a barrier which won't allow the sperm and the egg to fuse. The sperm and ovum are not going to fuse because there's a barrier there. Now these condoms are made up of thin rubber latex sheath. Remember, it is thin rubber latex sheath. So whenever we say thin, that means you can't use these with spermicidal creams because the layer is very thin. It can get ruptured. So can't be used along with spermicidal cream. Please write this point. Moreover, it also prevents from STDs or AIDS. So this is a very good advantage of condoms because they provide protection from AIDS and STDs. Now you see, they can be male condoms or the female condoms also. And female condoms are also one side it's open, one side it's closed. So it is placed near to the cervix where it is not possible for the sperms to enter. So anyway, both of them don't allow the sperms to reach the passage of the uterine passage. Okay, so that uterine passage is not assessed by the sperms in this case because there's a barrier there. Now, some other birth control methods, like you can see here as a sponge. So this sponge is placed in the cervical region and it contains a chemical called Nonoxynol 9. Nonoxynol 9 is actually a spermicide. So this spermicide will help to kill the sperms. Okay, so this sponge contains nonoxynol 9, which is a spermicidal. But sometimes these sponges can be dangerous also. They can cause some irritation, they can cause some allergies. And there's one brand which is not more popular in India, but in some European countries you can find this, that is Today. Today is a brand of that sponge. Okay, now there are some other cervical barrier devices, so which are going to prevent the sperm. They won't allow the sperm to go beyond the cervix region. So those cervical barrier devices are the diaphragms, cervical caps, and the vaults. You can see here diaphragm. This is the diaphragm. This is the cervical cap, and these are fem cap or the vaults. Okay, now you see here, interestingly what happens is diaphragm is always a, this is D for diaphragm, you can say D for dome shaped. So please remember it is what? Dome shaped. Moreover, if you see cervical cap, so they are much narrower, they are not dome shaped, so their ends are much narrow as compared to the diaphragm. Okay, and in vaults you can see they have some straps also. They are removable strap is there, so there's a strap here by which they can be easily pulled out. Now all these cervical barriers, they can be used, these can be used along with spermicides, because they are made up of thick rubber. You can see they are made up of thick rubber here, they are not thin rubber, so can be used along with spermicides. So if it's used along with the spermicides, it will increase the contraceptive value of that. Is it okay? So let's continue and see diaphragm a little bit in detail. Now diaphragm is a rubber dome that is placed over the cervix before the sex, and is used with a spermicide. Along with the spermicides you can use it. So spermicides can be used along with the, so what are spermicides? Spermicides, example I told you, these are chemicals. These are chemicals that disrupt the availability of oxygen to sperms, ultimately killing them. So if you don't supply oxygen to sperms, they will ultimately be killed, ultimately killing them. Hope you understood my point. Now, so these are chemicals here. Spermicides are what? Chemicals. And examples of those chemicals are boric acid. This is boric acid. Okay, this can be citric acid also. This can be potassium permanganate, KMNO4, and even nonoxynol 9 also I told you. Nonoxynol 9 also is a spermicide. Okay, understood now? Let's continue further and see what are the advantages and disadvantages of using these barrier devices. Now, advantages are the unwanted pregnancy will not happen. That is good. But the problem is, if these kind of devices, they are placed much more time in the vaginal tract or in the reproductive tract, they can have much more dangerous consequences. Like one of the most important diseases, toxic shock syndrome. So if it is left in vagina, because they are reusable also. As you saw, these are reusable. Okay, diaphragm, cervical caps, they can be reused. So when something is being reused, they may be prone to infections. So they may cause toxic shock syndrome, which can lead to death also. So toxic shock syndrome comes because some bacteria are, you know, now able to thrive in those conditions, like staphylococcus bacteria, and they can produce some toxic, which can have much major effect on the health of the women. So they should be avoided, or if they are used, they should be used with a very proper, sanitization technique should be used for that. Okay, so let's continue further and let's see about the intrauterine contraceptive devices. Now, what are intrauterine contraceptive devices? You see a very small intrauterine contraceptive device. You can see there's a copper being wrapped over this, the copper wires, you can see wrapped on the plastic structure, and that is the copper T. How it is placed inside the uterus, you can see this is the way they have been placed inside. Okay, and there's a thread also, you can see here, by which it can be pulled if it is required. But the problem is it is again not an ideal contraceptive because it is not user friendly. It has to be inserted by a trained nurse or the doctor. Anyway, let's talk about it. So these devices are inserted by doctors or expert nurses in the uterus through the vagina. Okay, so that means it is not an ideal contraceptive because it's not user friendly. So you can say it's not user friendly. Okay, now, so the first IUCD, that is intrauterine contraceptive device, was used by Grafenberg, and that was not made up of copper or something, that was made up of silver. So this was made up of silver, and until this was used, there was no pregnancy. So that was confirmed by Grafenberg. Now, these days, copper-based IUCDs are usually used. Okay, so let's discuss what types of IUCDs are available. So majorly 3 types of IUCDs are available. One is non-medicated, other is your copper-based IUDs, and third is your hormonal IUDs. So if the question comes LNG20 or the Progestasert, that is a case of what? That is a case of hormonal releasing IUDs. If a question comes copper 275, Cu275, CUT, Cu7, all these are what? These are your copper releasing IUDs. Multi-load 375, Cu7, copper T, all are copper based IUCDs. Moreover, Leap's loop is a non-medicated IUD. This is very important. So Leap's loop is a very famous non-medicated IUD, which is made up of plastic or stainless steel, that is made up of polyethylene components, and they are impregnated with barium sulfate, and these are usually used in many parts of the world. But the mechanism of action of these types of IUD is a bit different, and let's see the mechanism now. For example, if I talk about non-medicated IUD, so non-medicated IUD will promote the phagocytosis of the sperms. This will promote phagocytosis of the sperm, whereas copper releasing IUD will suppress the sperm motility. Please remember, suppress the sperm motility means you're using copper releasing IUD. Now, hormonal releasing IUD will inhibit implantation. That also you can write, hormonal releasing IUDs. Okay, affect implantation. So they are going to not promote implantation. So this is the one. They are going to affect the implantation. Very, very important point here. Now, the other contraceptive devices or the chemicals are going to be discussed now. So we are going to discuss about the contraceptive pills. Now, as you can see a strip here, which has around 21 medicines in different color. They are in white color, and rest 7 are in different colors. This is to maintain a proper, menstrual cycle, proper, periodic menstruation should occur. For that also it is important. Yes, because the 21 days, the hormone level has to be maintained. For the 5th day to 25th day, the hormonal level has to be maintained. After 25th day, the progesterone level has to come down so that menstruation can occur. Okay, so let's discuss now. So daily pills, that is oral pills, are started preferably in the first 5 days of the menstrual cycle. So first 5th day you will be starting with that. So when you start with 5th day, you will be ending on 25th day. That is 21 days. Now these pills, they contain some iron or iron pills in those rest 7 pills. They are not having any hormones. They are having some iron, so that whatever the loss of the iron is happening in the blood, that should be compensated by that. During a menstrual cycle which is going on, these pills are to be taken. Okay, so let's continue further. Now you see composition of those oral pills. What does this oral pill contains? So they are, if they are combined pills, there are 2 types of pills. One is combined pills, other is your mini pills. Progesterone only pills can be there, they can be combined pills. Combined pills will have both, that is progesterone also and estrogen also. So here you see we have synthetic progesterone. Synthetic progesterone is norethiosterone acetate, that is in high concentration here, whereas synthetic estrogen is ethinyl estradiol, which is in low concentration. Always remember that there should always be high concentration of progesterone. So when there's a high concentration of progesterone, it will block the FSH and LH release, and that will not allow ovulation. So let's see how these pills work. So you can see this will stop ovulation. It will thin the uterine lining, which is not ready for the implantation. Thickens the cervical mucus also, very important. Let's see how. Low level of estrogen in the pill prevents pituitary gland from releasing the luteinizing hormone. So when the luteinizing hormone is not coming, the ovulation will not occur. So it will stop ovulation. When no LH means no ovulation. Here you see when progesterone is there in the pill, the mucus lining, the cervical mucus is becoming thick. That is blocking the passage of the sperm. So this is thickening of the cervical mucus. So in this way, it is not facilitating the sperms to enter inside the uterine region. Okay, and even the ovulation is not there. If they enter also, it is not possible to fertilize. All right. Yes. Now you see we talked about Saheli. Saheli contains a chemical called centchroman, or it is also called ormeloxifene. So this is anti-estrogenic. Okay, so this is going to inhibit the estrogenic receptors. So the estrogen receptors are being blocked, not the hormonal level are being disturbed. That is a very good strategy which has been developed by CDRI. So this was developed in CDRI Lucknow. The scientists have developed this, and this is completely world's first non-steroidal pill. It is taken once a week. Taken once a week. That also you can write. Taken once a week. So it's a weekly pill. That is also a good thing. It is not taken every day. It's not a daily pill. It's a weekly pill. Okay. So that is also a very good strategy here. Now, some people don't want to take everyday pills, or they're not interested to take pills. Maybe they have some kind of allergy with taking pills or something. So they can go for some injections. And those injections, if they are taken, there's no need to take any pill till 3 months almost. For example, there's an injection of Depo-Provera. Depo-Provera, that is DMPA. It is called DMPA. That is depomedroxyprogesterone acetate. That is, depo means the slow release of the progesterone which is happening here. So this is going to release the hormone at a slow pace in the body, and that will not allow the ovulation to happen. So this is called as injectables because they are injected in the body. Okay, so these injections have high level of progesterone, which is present to inhibit secretion or of the gonadotropes. So ovulation is always and always absent in this case. So no ovulation, that's a good for the contraception purpose. Okay, so let's continue further with the implants. Now suppose someone wants to go for any kind of contraceptive and they want a large gap, maybe they want 2-3 years gap. So the best will be the implants for them. If they want a long term, spacing, they can go for implants. Now here you can see there's one implant, that is implanon, one implant only. You can see here implanon. So implanon is having one tube only. But if you talk about norplant, so norplant will have 6 tubes. It has 6 tubes in that. But implanon, you can see it has only one tube here. Okay, only one tube. Is it okay with you? So these are implants which are implanted under the subcutaneous skin. So no bleeding, nothing. They are very safe and they can be inserted inside the body, the subcutaneous tissue, and slowly they'll be releasing hormones, and they are usually effective from 3 years till 5 years. Okay, so let's continue further. Now a very important discussion on male contraceptives. Usually there are no contraceptives for male. Most of the contraceptives are for female, but there have been attempts to make male contraceptives. For example, there was gossypol produced from cotton seeds, but when this was used and the side effects were known, it was really dangerous to know about it because it used to cause azoospermia. So it is causing permanent azoospermia. So this has been banned now. So gossypol, which was made from cotton seeds earlier, it was preventing the spermatogenesis, but now it has been banned because it is causing what? Permanent azoospermia, means now the no sperms will be formed. So that is very dangerous. In around 2000, July 2000, China also made some progesterone pills, first time in the world, but they were not very effective. Okay, and there's, you can see, dimethylendrolone undeconate, that is DMAU, that is dimethylendrolone undeconate. That is a contraceptive which is used these days, which is being studied as male birth control pill. It has got a combination of testosterone and progestin. So they are working on it. It is under the research, not in the market still. Yes, now we'll be talking about some emergency contraceptive pills. Now those contraceptive pills which can be taken within 72 hours of unprotected sex, okay, they are called as the emergency contraceptives. And for that, IUDs also can be used. Even the IUDs also can be used. You can see here, IUDs can also be used as an emergency contraception if they are inserted within the 72 hours of unprotected sexual intercourse. Otherwise, high concentration of progesterone only pills can be given, like I pill. So they have high concentration of progesterone, but it's usually not recommended because suddenly you are going to have more of hormonal imbalance. So they are not recommended, but if situation arises, they can be taken. Okay, so these are emergency contraceptives. Even mifepristone is also recommended in some cases, but usually that is for abortion. Now next, see the natural methods of birth control. Now natural methods of birth control, they don't give you much of success rate. They have very high failure rate, but the plus point with them is they have no side effect. So no side effect in that. So these natural methods can be rhythm or periodic abstinence method. It can be withdrawal method or the coitus interruptus, or it can be the lactational amenorrhea. In all these cases, there is no side effect, but failure rate is very high. That's why they are not recommended well. In rhythm or periodic abstinence, they say coitus should be avoided 3 days before ovulation and 3 days after ovulation. That means from 10th day till 17th day, the coitus should be avoided. Okay, but the problem is this is not very predictable, because the ovulation can happen. It sometimes the days can vary also. In that case, it can't be very viable source of contraception. So that has a very high failure rate also. Next is the withdrawals or coitus interruptus. In this case, during the sexual intercourse, male withdraws the penis from the female vagina. But in this case, it is also not safe, or it is not also more viable, because some pre-ejaculation can also happen, and in that case the sperms are released without the conscious knowledge of the male in that case. Next comes the lactational amenorrhea. This is a natural method of contraception by nature only. If the mother is fully breastfeeding the baby, then only this is valid till maximum 6 months, because at this time there will be a high level of prolactin. So when there's a high level of prolactin, it will not cause the ovulation, because the FSH and LH are not going to be promoted. So in that case, this is a perfectly okay natural. Nature has given this to the mothers to protect themselves from the early pregnancy being established. Okay, so this was all about the natural birth control methods. It was much easier, I think. Terminal method of birth control. Now these are called as a sterilization method or the terminal method, because after that they are not going to be reversed. These are irreversible methods of birth control. So for males it is vasectomy, and for females it is the tubectomy. In vasectomy you can see the vas deferens of both vas deferens are being cut and tied, so that passage of sperms will not happen. Semen will not contain the sperms. Semen will contain the fluid coming from the other glands, but it will not contain the sperms. Okay, so this is effective, but reversibility is very poor. Okay, you can't go for reversibility of that. Next you see the tubectomy. So tubectomy can be of two types. You can see this is one, you can cut it. In this case the fallopian tubes have been tied and cut, but in other case you can go for ligation also. You can go for a ligation. This is ligation. In this case tubes have been ligated, they have not been cut. So anything is okay if you can cut it or you can ligate it. Okay, so anything can be followed. In this way the transportation of the fertilized or the ovum will not happen. The ovum is not going to be taken inside the uterus. That is a good way to block the gamete. So both of the techniques like tubectomy and the vasectomy are going to block the gamete transport. All right? Yes. Now you talk about the MTPs, medical termination of pregnancy, which is actually an intentional or voluntary termination of pregnancy. It is under the consent of the mother, and for that permission has to be taken from the doctor. One medical practitioner will be there till 12 weeks, and after that 2 medical practitioners will be taken into consideration. Their suggestion has to be taken. Now, intentional or voluntary termination of pregnancy before the full term is called as MTP. This is also called induced abortion. For that, the Indian government has legalized this in 1971, and around 2 amendments have already been done, and already one more amendment is there for the president approval here. Okay, almost they have got the approval from the president also. So it is relatively safe. If anyone goes for the medical termination of pregnancy or induced abortion, it is safe till the first trimester, but after that it can be a bit risky. For that, suggestion from prescription from 2 doctors is required. So let's see how. This was legalized in 1971 with some strict conditions to avoid its misuse, because it was being misused in case of female feticide. That is why it is very important to control its procedure. Now 45 to 50 million MTPs were performed in around 2006. In this around 2006, they were being performed all over the world, which was accounting for around 1/5 of the total number of conceived pregnancies in a year. Now it would have multiplied many times. Okay, and you can see here, this is the kit which is available in the market. Contains mifepristone. So mifepristone is anti-progesterone. This chemical is what? Anti-progesterogenic. Whereas it is used along with misoprostol. Misoprostol is going to what? It is actually a kind of prostaglandin. So prostaglandins, they are going to take out the, after whatever the leftover of the fetus will be there, that has to be also taken out. For that, there is a prostaglandins also, which are going to remove those leftovers. Okay, so this is a kit which is available in the market. Now we'll be talking about a very important topic called sexually transmitted infections. Now sexually transmitted infections, they are also called STIs. They are also called as venereal diseases, or RTIs, that is reproductive tract infections. They are more common in females as compared to males. And what are the types of STDs? You can see these are gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, and HIV. So there are viral, bacterial, and protozoan disease. For example, trichomoniasis is a protozoan disease. Whereas if you talk about hepatitis B and HIV and the genital herpes, these are viral diseases. And that is why, except hepatitis B, genital herpes, and HIV, most of the infections can be cured. But these are viral diseases and they are difficult to cure once they are in their later stages. Okay, so let's discuss about what dangerous effects it has on the health of the female. So these symptoms will be itching, fluid discharge, slight pain, swelling in the genital region. You can see here swelling, inflamed fallopian tube also you can see here. Okay, and STDs may cause pelvic inflammatory diseases. That is much more dangerous, because in the pelvic region also inflammation can happen, or even worse cases it can cause cancer of the reproductive tract. So these STDs can be much more dangerous. So they have to be taken care properly. So proper antibiotics and proper medicines have to be taken if this is present in anyone. Now, so this diseases, how they're going to be prevented. So avoiding sex with unknown partners or the multiple partners in this case, and using the contraceptives like condoms during the coitus, because condoms prevent STDs also, as you know. Moreover, in case of any doubt, one should consult a doctor for early detection. Early detection is going to save them much easily. Getting complete treatment for the diagnosed disease. If any disease is diagnosed, they have to go for a complete treatment. If you don't go for a complete treatment, it may again revert back. So next we'll talk about the infertility, that is assisted reproductive technologies. Now, the couple who is unable to produce children in spite of unprotected sex is called infertility. For 1 or 2 years still they are planning to have baby and they are having those normal coitus, but still they are not able to have it. So maybe male or female, anyone may have some kind of problem in that. So let's see what can be the reason. The reasons can be physical. They can have some diseases, or they are under the effect of some drugs, or they can be immunological. For example, sometimes sperms are regarded as foreign substance in female reproductive tract. That can be some immunological case. Even sometimes it is what? Psychological also, that they are not able to have baby. That can be much more psychological problem also. That has to be dealt properly. So they are assisted reproductive technologies. there are IVF centers where they can consult. Now, what are the methods employed? So first one you can see IVF-ET, that means in vitro fertilization embryo transfer. That is in vitro fertilization embryo transfer. In this case, what happens if the if the zygote is less than 8 blastomeres, then it is transferred into a fallopian tube. But when it is more than 8 blastomeres, then that has to be transferred in the uterus. So let's see GIFT. GIFT means when some female is not able to produce ova or gamete, so that she can take it from the donor, because rest everything is okay in her. So that will be called as GIFT, gamete intrafallopian transfer. Okay. Next is ZIFT. ZIFT is zygote intrafallopian transfer. So zygote intrafallopian transfer, I told you, if it is more than 8 blastomeres, it is going to be implanted in the uterus, and if it is less than 8 blastomeres, it's going to be implanted in the fallopian tubes. Now next comes the IUI, that is intrauterine insemination. That is sometimes artificial insemination also, we can say. The semen is going to be inserted into the uterine region. That is a kind of artificial insemination. It is for those males, those who are impotent and they are not able to insert the semen inside the vaginal tract. So this was all about the infertility. Hope you understood this well. And there is one case called ICSI also, intracytoplasmic sperm injection. This is a case of intracytoplasmic sperm injection. So in this case, a single sperm is being fused with the ovum. So this is a case of intracytoplasmic sperm injection. Hope you understood this well now. So thank you for your patience, and please keep revising it. Thank you.